Welcome everybody to the Woman of the Year podcast series. This is episode 1, and we're lucky enough to have with us the Women in Healthcare nominee and winner. The winner is actually Dr. Noof, and we have Dr. Amy with us here today. Ladies, thank you so much for joining us.
Thank you, George.
Thank you
for
very
having
much,
us.
George. We're happy to be here.
Let's start off with a joint question for both of you. How do women leaders influence the future of healthcare in Bahrain?
Yes, so I think that Dr. Noof is a great leader. I work with her in RMS and I see her inspiring and encouraging young women in the healthcare field every day, pushing them to go outside of their comfort zones and do more and achieve more and set the bar higher. And Dr. Noof is a great example of a Bahraini female doctor who's gone outside and done training, come back and bring that knowledge and experience here to help women in Bahrain to excel.
Dr. Noof Alshaibani, of course, is the winner of the Women in Healthcare Award for 2025. Doctor, what experience shaped your own approach to healthcare leadership?
Well, actually, we are blessed as Bahraini women here by the support we got from Her Highness Princess Sabika and the King, of course. And as Amy said, I've been working for the Royal Medical Services for a few years now. A very busy oncology service as Bahrain Oncology Center made me think more about the patient, about the quality of service we provided, about the new generation that we need to train. From here, that gave me the strength and to lead.
Dr. Amy, can you share a moment, a situation where you felt your work had a significant impact on somebody's life?
Actually, that occurred when I was working in Saudi and it's continued here. I looked at opportunities or lack of opportunities that were there for young women who wanted to work in sports medicine. And here in Bahrain, we have 3 Bahraini female physical therapists and 1 athletic therapist who wanted to work in contact sport. And it wasn't something that was available for them. There wasn't an opportunity for them. So I took them on board and did 1 or 2 years of training with them on field. And now they are the leads in our sports medicine on field therapy. And they're doing a great job. And now they're training other young Bahrainis who are just finishing their studies and want to go into that same field. So it's set up a pathway for the future for Bahraini females who want to work in sport.
When they're looking after players or injured players or that, are they looking after female players or male players or both?
Both. And they're looking after contact sport as well as non-contact sports. So they're working in boxing and jiu-jitsu, rugby, motor sports. So areas that are in the Middle East, traditionally male-oriented, they are bridging into those sports because they not only enjoy those sports, but they have the capability and the confidence to deal with injuries that are sudden on the pitch, and also to take that from there to the clinic, rehabilitate them, and return them to the field again.
What advice would you give, or perhaps not give, to women planning to enter the medical profession?
I would tell them that they have to look after themselves first, especially being a single female and going into the medical field is one scenario. But if you are married and have children and you're juggling a family and your career, that's another scenario. And you have to put yourself first because you have to be healthy and strong and able to handle that double responsibility. So don't feel selfish for looking after yourself.
Well, actually, the medical field, it's a demanding field. But at the end, it is rewarding. I just give them advice that they have to work hard, have confidence in themselves, and at the end, they will be rewarded.
Dr. Noof, how do you balance clinical work with mentoring others?
maybe Amino, our commander is running 4 hospitals under the Royal Medical Services, and still he is, you know, operating, going to the clinic. So I was inspired by that. I found the balance between taking care of my patient and doing my administrative job, treating the patient at the time being. We are looking also to have a leadership in the health in the future with the training the trainee as well.
How do you both balance innovation, care, and teamwork?
We actually work together on a team.
Yeah.
That's good. That's
Yeah,
teamwork.
we do.
Yes.
So I would say that, you know, for the innovation part, there are things that we try to strive for and work towards so that we can be cutting edge and we can be at the forefront of what we're doing. So you have to make sure in the teamwork that everyone's on board with the same goal, and respect everyone in the team, because everyone has different opinions and different eyes and different expertise. And the way to reach a high level is to take from everyone and build on that, I would say.
Yes,
Yeah?
I agree with Emmy. Actually, you have to have a strong team and you have to have a goal. And all of us, we need to work toward that goal. And again, technology without you have compassion, you have, you know, a great team with you, it will not work. Everything should come all together. And usually with my team, we sit together, we are firm, we take care of things, and they know me during the, you know, the working hour. I am very, very tough, sorry to say that. But after hours, we go out. Like it's a habit. Every month or every 6 weeks, the whole team will go out. We sit together, we forget all about work. And I think this is also, it's important.
Do you think people can learn a positive bedside manner, or is it something that they actually are born with or not?
Well, I mean, an industry joke is surgeons don't have good bedside manners, so they become surgeons because their patients are asleep.
Not really.
Not all of
Not
them.
all of-
Not all of them. But no, that's something I think nowadays in modern medicine, it's much more important. In the past, in generations before, it was accepted and that your doctor maybe didn't talk to you too much or didn't explain something and you just did what you were told. People are different now. We've evolved and people want an answer. They want to understand why. Why are you taking this thing out of me? Why are you cutting my joint? What is it going to feel like after? And so I think it's essential for all doctors and all healthcare professionals now. Studies show now that if you connect with your patient, even if you don't do anything to them, they're going to feel better.
Especially like I'm treating patients with breast cancer, you have to show a lot of compassion, you have to have communication skills. The whole team need to be very supportive, very positive. In spite I'm doing a great job with my surgeries,
Yeah.
okay, a very good result. The patient keep mentioning how they don't forget my smile, how I
Yes.
approach them, how I break the news to them. They may forget what, you know,
Yeah.
I did for them, but not how I leave them
Yeah.
feeling with.
What is your attitude towards patients who say, listen, doctor, I believe I've got to have surgery or I've got to go this process, but I also want alternative therapy?
Well, I will, if it will not harm or affect the treatment that we are providing, like surgery or chemo, I will not, you know, have any objection. But the issues what we are facing now, some of them, they will go for, you know, certain diet, or way they will need to, you know, postpone their treatment for 3 months. For me, dealing with cancer patients, you know, every minute make a big difference in their life. It is their choice, but I have to explain what's the benefit and what's the harm they may cause to their self by delaying their treatment.
Things like energy healing or certain Ayurvedic or practicing yoga or meditation, those are all supportive mentally to making the patient more resilient. But there are studies that show patients who enter into chemo or surgery who are mentally prepared and are resilient within themselves and have a support network, they have better outcomes than people who haven't practiced those things. What I say to patients is try to get as strong as you can before you start chemo or radiation or before you have the surgery, because you're going to get better faster afterwards.
What would you have been had you not been members of the medical profession? What?
When I was little, either I said I want to be a doctor or be a flight attendant, to be all over the world.
So you can go.
Yeah.
And of course, you could have saved people's lives on board, because
There you go.
occasionally people have heart attacks. So you could have done both, two things at
Maybe
once.
one.
You could be a flight doctor.
Dr. Amy, what would you have done?
Ooh, I think I would have been a chef, because I love cooking and I love entertaining, and I think that's what I would have done. I don't want a big restaurant, I just want a little place where lots of interesting people come from all over the world, and I can meet a lot of people and learn about the world that way.
You like cooking yourself, do you?
I love it. That's one thing all my staff are like, how do you have time to meal prep in the morning and do all these things? That's my relaxing on a Saturday. I go to the farmer's market and then I meal prep for the week, and I enjoy that.
Ladies, what has being involved with the Woman of the Year Awards meant to you personally and professionally?
It was an honor, to compete with a lot of lovely ladies. And my responsibility, I feel, toward my patient, to my country, to become, more and more that I want to lead and be better.
Yeah, it was a great honor. This is my second home, my other red and white flag. and it was a real honor to be recognized for the things that I've been trying to promote and achieve here in healthcare. I can see that there's been a lot of initiatives and a lot of changes and a lot of improvements in healthcare in Bahrain over the last several years, and it's an honor to be a part of that.
Dr. Noof, finally, do you have any other ambitions that you would like to fulfill before the end of your career, or even personal ambitions, personal or professional ambitions?
Well, as a surgeon and as a leader in breast cancer, I always hope that one day every woman being diagnosed with breast cancer should not face this disease alone. There should be the family around her. We are around her. We want to provide a system that take good care of her. So this is, what I'm looking at.
Thank you so much to
Thank
both
you,
of you
George.
for
Thank you.
joining
for
us this
having
afternoon.
us.
It's
Thank you,
very
George.
interesting, and
Thank you.
we had a few extra questions than we planned, but you inspired me to
Thank
think out of
you.
the box. So thank you so much.
Thank
indeed.
You're
you.
welcome. Thank
Thank you.
you.
So that's the winners and the nominee of the Women in Health category. Thank you so much for joining us, and look forward to seeing you on the next one. Thank you very much indeed.